All right, hey, good afternoon, everybody. It is just a few minutes after 2, so we're going to go ahead and get started. Thank y'all so much for coming. Thanks, Justin, for your help. We appreciate you getting everything on the screen. Thank y'all so much for coming. Thank you to Senator Payne for agreeing to this joint hearing. And this actually was Senator Payne's idea, I think, to get a joint hearing together so that we could all hear from Commissioner Ross at the same time. And so appreciate y'all being here. Commissioner Ross, thank you so much for being here as well. And I'll turn it over to Senator Payne for a few remarks.
Thank you, Mr. Chairman. I just wish to wish everyone well and thank you for being here, and also just understand that the reason I had the idea of a meeting as a joint committee because both committees are doing are focused on our veterans and trying to make things better for in the lives of our veterans. So I thought it would probably be beneficial if we're kind of start off from working from the same page and hearing from the commissioner together. So I just want to say thank you for being here.
Well, thank you, and we'll ask Senator Ed Harbison to say our invocation for us.
Thank you, Mr. Chairman. Appreciate it if you bow with me. Father God, we thank you for another day to get it right. Thank you for allowing us to serve the people of this great state in our particular districts. And Father God, let us be godly in our deliberations and consider the big and the small and everybody concerned. In Jesus' name, amen.
Amen. Amen. Thank you, Senator. So the way we're going to run the meeting today is Commissioner Ross is going to go through an update for the Department of Veteran Services, and then we're going to open it up for member questions. If there are members here that are not a part of the committees, you are more than welcome to ask questions as well. So you will certainly be recognized. And with that, Commissioner Ross, I will turn it over to you for your presentation.
Thank you, Chairman Bonner, and thank you, Chairman Payne, and members of both committees. What an auspicious day to be in front of both of you at the same time to provide an update on what Georgia Department of Veterans Service does, kind of where we're headed, and actually highlight some of the things you probably don't even know that we do. So I'm Trish Ross. I'm the commissioner. Many of you know me, but with that, I'd like to get started. Just good pictorial of here in the Capitol. If I could explain kind of basically how we're structured within the state, we have 4 different programs, the first of which is Veterans Benefits. That's how many of you know us, is through the Veterans Benefits process. And real quick, just because I know probably more so for those in the very back of the room versus those of you in the front of the room, I'd like to highlight the difference between us and the U.S. Department of Veterans Affairs or our federal counterparts. Because we are different, we have different missions, but people get us confused. So on the left side, you see what the VA does. We primarily overlap with the Veterans Benefits Administration. They function in 3 parts. Veterans Benefits Administration, we are the individuals in about 55 offices across the state who help your veterans and their survivors apply for veterans benefits. So whether that be pension, disability benefits, survivors benefits, etc., that is what that team does, plus a whole lot more, which I'll talk about in a minute. On the National Cemetery Administration side, the VA side, we are a subrecipient or a grant recipient, and we have 2 state veteran cemeteries that are inspected by the VA. We actually get funding from the VA to bury our eligible veterans, and we operate those, of course, in concert with national standards, our National Cemetery Administration standards. So if you go to the cemetery in Canton and go to one of ours in Milledgeville or Glenville, they're going to look very similar, same standards. Where we kind of diverge is VA Health Administration, or VHA. So we don't have hospitals, doctors, clinicians, podiatrists, prosthetics, et cetera. That is the U.S. Department of Veterans Affairs. And if I had to kind of encapsulate the majority of the constituent requests we get is about veterans not receiving appropriate health care, which is the federal side of things. We are more than happy to get that to our federal partners, but the only place where we truly overlap with VHA, or the Healthcare Administration, is through our 2 state veteran homes. Those are overseen by the VA. We do get funding per patient per day for the veterans that are in those facilities, and they're also one of our regulatory agencies, and I'll talk about that in a little bit. So that is how we differ. So I'd like to just start with that slide so you understand a little bit more about our mission as codified in Georgia Code. So some key takeaways just right off the bat, when you look at where we've distributed our offices, and in fact the VA now has put an emphasis on making sure our transitioning military, those new veterans, are getting the benefits that they have earned and are connected immediately after service. Well, we've been doing that for the last couple of years, making sure that we are on our military installation so we can provide that benefits assistance and that kind of soft landing post-military service, because we all know, if you've read any of the literature or done any research on our transitioning military, if they don't land well in that first year, if they struggle in that first year, they're more likely to have suicidal ideations, domestic violence, substance abuse, become homeless, become justice involved. And so we are on Fort Benning, Fort Stewart, Fort Eisenhower, Kings Bay, right outside of Dobbins Air Reserve Base in the Vector Center at Chattahoochee Technical College. We're right outside of Robins Air Force Base at the Georgia Vector Center. We're also in Marine Corps Logistic Base, Albany, their Vector Center that they're standing up. We also partner with our federal side. So we're in 22 VA facilities, and that's to make it easier on our veterans. It does confuse our veterans because we're in those facilities, but if somebody is to receive a diagnosis or has medical documentation that will help in their disability claim, they can just walk it down to our office. So we try to co-locate with the VA wherever possible, and honestly, it's usually based on whether they have space for us or not. And then our most recent kind of partner in this is the technical college system. And you may say, why the technical college system? So in those areas where we were leasing space, we found efficiencies in going to the two-year college system, because research will tell you that for those military members coming out of the service that are going to use their education benefits, they start in a two-year college. And so this is our two-year college system, and the technical college has been very gracious to allow us space on their campus. So that's kind of where we're located. If you look at kind of the overall population here in the state of Georgia, I like to point out we're a large constituent base. When you take our military members, reserve, guard, active duty, we're closing in on 13% of Georgians. Most people don't realize that. They think we're kind of this niche group, but we're a large population here within the state. Compare that with kind of what we bring in on the benefit side. So we actually rank 9th for veterans. We're 5th for active duty in the state of Georgia. But overall in veterans benefits that solely can be attributed to the work of Georgia Department of Veterans Service and our amazing service officers and appeals officers, we brought in $5.2 billion into Georgians' pockets, into veterans or their survivors' pocket just this last year. And all of this is at no cost to the veteran or their survivor. We do this for them. That is what you allow us to do as a state agency. And I do want to point out, because I've had this question too, there's an agency like ours that does this in all 50 states, 5 territories, and the District of Columbia. So we're a little bit unique in that some of what we provide differs from state to state, but all of us have an organization, call us whatever you want, that is veteran focused. Some of our key metrics. Now the VA's data is a little old and they've used some actuarial tables. So they say we have just over 652,000 veterans in the state. They've not taken into account migratory patterns, and we know many veterans are moving to the state of Georgia and here to the southeast. So I think the number is actually woefully underrepresented, and the VA will tell you that's about 60% overall of our veteran population, because there's about 40% that they don't account for because they're not tethered to the VA. They're not enrolled in VA benefits, they're not enrolled in VA health care, they're not using their educational benefits, they don't have a VA home loan. So the VA doesn't know about 40% of the veterans in the state. Just so you know, this last year we helped over 89,000, almost 90,000 veterans in office visits. That's one-on-one. That's up 10,000 visits from last year alone. So we're seeing an increased volume in our offices. We've submitted almost 40,000 claims. Our outreach events, we've actually escalated the number of outreach events. We've increased by, goodness, well over 50 this last year. Our Veterans Cemetery also is a decent amount of burials. Both cemeteries are doing well on that account, and I'll cover the cemeteries in a minute. We are also serving 60 more veterans in our Georgia War Veterans homes this year than we were last year when I snapshotted this data. And our appeals team, which is a team co-located with the VA and the regional office off Decatur, they personally were responsible for over $40 million in retroactive awards. That means the VA got the decision wrong. They went through the appeal process, and our appeals team, in going before a veterans law judge and the Board of Veterans Appeals, along with that veteran, ended up getting $40 million additional into veterans' pockets. Some of the things you may not know is how laser focused we are on suicide prevention and the mental and behavioral health of our veterans. So we got a grant last year for a suicide mortality review committee, and I do want to highlight real quick what this committee does. It was grant funded for the first year. We are still doing this even though we have lost grant funding, and I'll tell you why. It's so vitally important to the work we do as a department. We did a landscape analysis with our partners at the Advancement for Military and Emergency Services Research Center, so the military-focused team at Kennesaw State. Excuse me. And we looked at the violent death reporting system. We got access through public health, and we did as far back as we could get data on what veteran deaths look like. So we could provide some demographic data before we started on this review committee. And you can see some of the information that we gathered. And let me show you what we found. During that time, you see, yes, we kind of trailed off a little bit in veteran suicide, but we still at 17.6, honestly, last year, we had 200 veteran suicide. We're still double the national average. So this is still, while it may seem like small numbers to you, I think we all would agree one suicide is one too many, and it is a significant issue in our population. So those are the overall numbers, but let me show you kind of what we saw when we looked at more recent suicide data. And this would have been within the last 12 months. Some of this may not be surprising, but the majority were male, were white, over 50% were in a relationship, about a third had a college degree, the average age was 56. Firearms, the number one reason that our veterans die, mainly because of lethality, and they're comfortable, right, with firearms, was responsible for almost 80% of deaths. And in at least the longitudinal data that's historical, about 63% of deaths occurred in the morning hours. But when we dove a little deeper in working with our medical examiners and coroners with this team, and I did want to highlight kind of the people that do this work. So it's the expert researchers at Kennesaw State. It's those folks within my department that bring that veteran experience. It is coroner's office. It's actually the suicide prevention expert with DBHDD. We have an epidemiologist from DPH. And then we kind of round out, we have a subject matter expert who actually does psychological autopsies on military. She actually is an expert in her field. She was part of this team as well. So if you look from last year up to December, and we're getting ready to do another one of these next month, that's just our timeline. And again, this is just to highlight kind of how we built up and are continuing this work. I do have to say that we're now recognized nationally for this work. I've been invited, as well as Dr. Brian Moore from the Ames Center, to present the findings for what we're doing and seeing in veteran suicide here in the state of Georgia. So what were some of our recommendations? You might find this surprising, and I didn't necessarily pick this because we have a member of our Senate committee, but Muskogee County, we had a great relationship with their coroner's office. 75% were minorities, 75% were experiencing relationship issues, and so we looked at ways that we could kind of address some of those issues early on. Again, we're in the business of prevention, not reaction. Firearms, in this case pistols, we had one asphyxiation, and we found that just after kind of the work day, it seemed like folks got into a squabble with their significant other, and that's when they were committing suicide. This is just those 4 cases during that time. The next one, and only because 4 out of 5, we didn't have a lot of information. The death investigator did not provide us any information other than this individual was a veteran, so we couldn't really parse out anything from the record. But using Muskogee and then adding Cobb, 60% were minority, 40%, again, you saw nationally in our historical data, they're usually mid-50s, but we found 40% were under the age of 30. And if you look at the VA Secretary Collins' most recent suicide statistics, our younger veterans are committing suicide at a much higher rate, which is why we're so focused on our transitioning military. 100% in this case were experiencing relationship issues, every last one of them. And then 100% died by firearms. And then again, because we couldn't find information on the one individual, 80% we found a record of mental and physical health issues, both of which are considered kind of comorbid conditions to suicidal ideations. If you're experiencing chronic pain, if you have mental and behavioral health challenges, you are more likely to consider suicide. So we're looking at promoting more holistic options, whole health. We're doing a whole lot of training, and I will talk about that in a second. So we're in our 4th year of a suicide prevention grant. It's called the Fox Grant. We're one of the only organizations that's been offered that grant for all 4 years that's a state organization versus a much smaller nonprofit. We do partner primarily with Kennesaw State and that same team because it was very research focused in the beginning, and now we have shifted more on actually assisting individuals. In 2023, we screened about 4,500 individuals, and then we've increased year over year by about 250%. These individuals, of course, we wanted to get them connected to the VA. That is why the VA gives us that grant. But in the event that they are not eligible for VA services, we connect them to DBHDD. Of course, strong proponent of 988-911. And then we have a database of community partners that we make sure that they are receiving the mental and behavioral health that they need. These are some of the trainings that our team does, whether it's mental health first aid, SAVE, ASSIST, ACE, SI. We did 200 outreach events. We will train pretty much anybody that asks us to train them, especially on identifying the signs, knowing how to ask the questions so you can interject and again be part of that proactive piece to ensure that that veteran is ultimately not considering taking their life. We did a Let's Connect Summit. We did that for 3 years, 97% satisfaction. And then we ended up referring folks to a host of partner organizations because we found while they may be coming in or we may be screening them at all of our offices and our outreach events and they're showing moderate or high for suicidal risk, we ultimately found that maybe that was financially driven by housing insecurity, not having transportation, not knowing how to navigate their benefits, needing food assistance, legal issues, money management, utility assistance. So a host of kind of this confluence of different needs were coming together that ultimately was resulting in these folks screening moderate or high. Those folks are referred to our team. We reach out within 24 hours and get them connected, right? We don't want anybody to wait if we know that that is something that they are considering or that they are at high risk. So another thing we're doing, and this is at no cost to the state, nor are we getting federal money for this. The other two things we got some federal money for, but it's our mental and behavioral health app called Here Now Help. So this is available to every veteran in the state of Georgia, and you do have to be a veteran. But it's an app that provides kind of wellness videos. It provides prompts to journal, to think about gratitude. You name the whole health perspective about making sure that your mental, behavioral health, physical health is good. It does all of that through prompts. It also creates community groups, so you can choose to be in a group, say, for me, I want to be in a group that did this in the military, I want to be with this branch of service. Whatever the case, you can do that. But most importantly, you have 24/7 access to clinical providers around the country. No cost. No cost to all of our veterans. We're the 3rd state to roll this out. And you can see the code at the bottom. Folks can just scan this. It's in all our offices. And then 241442 is the code for Georgia veterans that will get you into this app at no cost. And again, access to providers. So we're trying to make this user-friendly and also targeting that younger demographic that I just spoke about that's now at higher risk. I know we're in budget season, so I have to throw up this slide. I talked about a couple of federal grants we got. Just so everybody is aware, about 50-50. We're an even split between what we get in federal funding and what we get in state funding as overall. And I know I usually speak in appropriations briefings after some pretty large organizations. Our numbers are in the millions, the small m versus the billions, but we are a 50-50 split for this year. So Unite Georgia, that is our closed loop referral system. I did want to do a quick demo. I'll show you what it does and then demo it. This was successful, I think, with our House Appropriations Committee because they wanted to see actually what the system does. So overall, we've connected over 18,000. Those are touch points with Georgia veterans, fully outreach to about 5,000. And what happens is folks come to us for many, many reasons. We connected to care coordination, and this left side that's care coordination, those are individuals that go to a hub. They're not our folks connecting them because that's the larger numbers. They're folks who usually self-refer themselves, either through a QR code or going to our website, and then there's a network hub that gets them to the right resource. The activity is us. So this is us and our partners. For the first few years, the Technical College System of Georgia was our partner. And now it's just us, but we do actually partner with the workforce development folks under TCSG, but we have numbers that far exceed anybody else in the nation. This is a national platform. We've rolled it out for Georgia's veterans, and we've seen some very high success rates. So over 10,000 veterans were served, almost 91% of our cases were accepted. We identified just over 16,000 needs, and this is a whole host of needs. I'll show you what that looked like. This is what really sets us apart. If you went to an organization, even to my organization, you said I needed help with housing, childcare, education, you name the issue, it would take us sometimes a couple of weeks to find somebody that was open, had money, was available, could meet your schedule, whatever the case may be. It now takes us 1.6 days for that referral to be accepted. And then 6.4 days for those partner organizations to actually meet those veterans' needs. So less than a week, those needs are being met by a partner organization, of which we have over 800 in the state of Georgia. We did launch a public resource directory. That was mainly because our nonprofit partners, they didn't really have the capability like we did to case manage folks and get folks individually connected to those resources and kind of follow them. They wanted a list. They wanted to say, okay, here are the resources in my area. They pulled it up by geography, could hand that out to somebody that may be coming in their door. And the idea was the no wrong door approach, right? Whether you came into one of our offices, the technical college, workforce, you name it. And there are 2 other state agencies that use this platform too. So this is how you get to us. One, you come into our office and we case manage you. We know, Kitty, that is part of our veteran service officers and our appeals officers' job is to help case manage those other needs beyond just benefits. So beyond benefits, we do all of this care coordination and get you to the right community partner. Or if you're not comfortable talking to us and have an identified need, you can put it in the system yourself. Or again, for our nonprofit partners or folks that just want to see what's available in their area, we have that QR code too. So we're going to cross our fingers right now. Oh, man, that didn't work. No, we're good. We're good. It did log me out though. So we are going to get back in. This is what Unitas looks like. So this is the platform. I will tell you that this is a demo platform. Whoops. Technical issues. Please stand by. I know we did this before. Maybe display settings. No?
I'll call Justin back. Wait, you keep calling.
No, we'll keep going. Let's see if I can get it to show. So we're going to go, I'm central office, because I do use this system, and see if we possibly can actually see this. We cannot. So we will pivot, and we'll wait. And we'll go back to my slides. It should be noted that although you may see some large numbers in our budget, we are the recipient of a couple of pass-through grants, which means we get no funding from them. It doesn't come to the department. It simply goes through us, and we manage the reporting, and we have the details on what the grants do. So one from last year was $1 million that went to Emory University for their PTSD research. They've seen some great results. Granted, some limited number of people that actually qualified for this study, mainly because they had to make sure that they weren't on other medications, or they had to wean off those medications before they could enter this research trial. In addition, they couldn't have some significant comorbid conditions, right? PTSD had to be their main diagnosis, but they've treated 16, and again, they kind of start off with the MDMA, basically, at a high level, and then they taper off after those first couple of days, and then they do the intensive treatment and therapy, and they've shown some great results. And this is the information that they provided. Again, we are a pass-through for this, but they've spent some of their budget or recruiting new patients to be a part of this clinical trial, but they are very excited about what that funding that the General Assembly provided them is going to do for PTSD and veteran mental health. One of our other grants that we administer, again, as a pass-through grant is the Mental and Behavioral Health Grant. I know Senator Payne had a committee that looked at mental and behavioral health as well as homelessness. Those are actually linked. Some of the people that have been funded through this grant is the Cohen Military Clinic. They're out in Hinesville supporting our Fort Stewart area. I will tell you right now, they've kind of tapped out. They're maxed out on the number of patients they can see. They've got a full complement of clinicians and counselors. It is a tremendous facility where they see folks and families in person, as well as they do telehealth. We've also funded the Emory Healthcare Veterans Program, so their brain health program. Again, it was that initial program beyond what that PTSD research is, where they bring folks in for a 2-week period. That is a kind of a outpatient process where they do whole health as well as intensive and immersive therapies. They've seen a great response to that, and you can see they had a 17% increase from the first 6 months to the last 6 months. A couple other folks that ended up getting the grant. In Forsyth County, we had About Face USA. They did mainly telehealth, behavioral health, making sure that kind of anybody in their catchment area were partnered for mental and behavioral health services, coping skills, job skills. They kind of did the wraparound services. And then Kennesaw State stood up a clinical portion of what they do and actually provided licensed behavioral health providers, mainly LPCs, licensed professional counselors, and now see not just students on Kennesaw State, but anybody, any veteran that either comes in or they do it via telehealth. So they've helped over 196 veterans, and we got the good news this week that they're going to be able to continue this for the next 6 months with the current funding they've already received from the state. Again, pass-through grant, but we do manage it. Okay, shifting from mental and behavioral health to cemeteries. Both of our cemeteries got expansion grants that we completed this past October. Both Milledgeville and Glenville should be good for about the next 10 years at current rates. But I will tell you, for the first time in the history of the National Cemetery Administration, both veteran cemeteries in a state were recognized for organizational excellence. So we hosted the National Cemetery Administration this summer, who presented those awards to both Glenville and Milledgeville. I know we had Representative Griffin there for that wonderful event. And so that's a really big deal. Your cemeteries are doing very well. And so I'd segue into the Augusta Cemetery, and I know we have some folks from that community, but Augusta has been trying for a veteran cemetery for the last 25 years, quarter of a century. They've been trying to get a veteran cemetery, mainly because the population just south of Fort Gordon is considered not covered by another veteran cemetery. So Milledgeville covers a portion, Fort Jackson in South Carolina covers a portion, but then there's a gap. But that was a gap that the VA told us for years and years they would never have funding to establish new cemeteries. Well, in a historic year for National Cemetery Administrative funding, courtesy of our own Secretary Collins, they ended up getting 10 times the normal amount and are actually establishing new cemeteries for the first time. And it just so happens, based on the amount that was appropriated, that they got to priority number 30, and priority number 30 was Augusta. So we've been scrambling to try and make this happen. We had some funds for many years in our budget to provide matching funds for this federal grant, and then when the VA said it would never happen, those were pulled back to the state, and now we're at the point where we're scrambling and are going to use those funds depending on how the budget process ultimately ends up. $800,000 is for the design of it, and then because we are sitting on the Gracewood campus for DBHDD, and I'll kind of show you, this is the Gracewood facility. We are just south of it. That facility, during Hurricane Helene, had to remove some debris, some significant debris. It's about $200,000 to actually get that off the property. And I don't know if you can see my cursor, but the removed debris up there, that's actually just right there where we'd have the entrance to the new cemetery. And so that is the $1 million that we had for quite a few years in our budget. That kind of rounds out the $1 million that we've been asking for in our appropriations briefing. And I should say, you know, all of these programs are separate, so can't cross programs. So we have veterans benefits, we have the cemeteries, we have the homes, and then we have our administrative program. So this is a cemetery program, and that funding could not have been used anywhere else within our department. Give you a little bit better picture of what the facility and kind of the footprint of Augusta will look like. And I should note that there are about 66,000 veterans in the Augusta area. So we believe that at some point, probably very quickly, this will be our busiest cemetery, because not only does it have a large concentration of veterans in the local area, it's outside of Fort Gordon, so an active duty military installation, and a lot of our veterans end up staying there. So the first amount of money to be provided by the VA in October, we're tracking with all of our deadlines, which means the $10 million, at least $10 million, will be coming to actually establish the cemetery. You can see, I don't know, we've got pre-placed crypts, we've got columbariums, we've got our ceremonial area, we've got what would be our committal shelter. For those of you I know that have been to our cemeteries, it'll look very similar, except we have to have an open air one now instead of a closed one. Give you some architectural renderings. This is going to be the admin building. Will look very similar to the ones we already have. And then the committal shelter will look also very similar, keeping that same kind of look and feel for all state veteran cemeteries here in Georgia. Another mission that a lot of folks don't realize we have, and this is funded directly from the VA, is our state approving agency. So you may think, well, people using their education benefits and the GI Bill, how do we ensure that those benefits and those institutions or those employers for on-the-job training or apprenticeships are doing the right thing by our veterans? I'm sure we've all seen the news about some kind of sketchy schools that are taking veterans' money and, you know, kind of duplicating enrollment and getting all of this federal money. We have the state approving agency, so we have a small team that actually goes out and certifies every institution that gets VA funding for education. So they are on the road a lot. Again, 9th in the nation for veterans, but we're 6th in overall education funding for the state, and we actually lead the nation in on-the-job training that we've certified. And so that's big business for us. That's big business for many of y'all that do have businesses. And so that's a function that our office performs that most people don't even realize kind of goes on behind the scenes. I know many of you may have questions about the Georgia War Veterans Home, so saving the best for last. I appreciate everybody that came out for the Transitional Support Unit opening. This was back in September, where the governor and the First Lady and many of y'all came to the facility to cut the ribbon on our subacute therapy unit and then the Transitional Support Unit. I know many of y'all have been on email traffic, because I've been sent that email traffic that says Milledgeville is not providing appropriate care for our veterans. I will tell you categorically that is false. By every objective measure, we are providing fantastic care to our veterans. And let me tell you how I know this. So we have quite a few regulatory agencies. So not only are we inspected by the VA, and that happens every month, or can be no notice. They just came a few weeks ago, no notice. And that went well. Our last inspection went well. We're also inspected by the Department of Community Health, so by the state is also a regulatory authority that inspects us at least every other year, if not every year. And then we voluntarily are part of the Joint Commission on Health. So they come every 3 years. It just so happened that all of those inspections happened to occur this year. So every last one occurred this year. And so if you go through kind of the metrics, the reason why this is important is you can see that compared to overall Georgians overall, almost 15.8% are over the age of 65, but 51% of our veterans are over the age of 65. So we know that they're going to need that type of care in the future, especially after decades of war. When you look at our nursing hours, we actually total about 5.2 for the nursing hours per resident day. We're required to be at 3.0, and you can see nursing homes across the state are anywhere between 3.0 and 3.48, so we are exceeding nursing hour standards. Turnover, of course, any healthcare facility has experienced turnover in their nursing staff. Across the board in Georgia, in skilled nursing facilities that are greater than 100 patients, of which that's where we fall, they've had over 50% turnover. We've only had about a third turnover this last year. Our surveys, so again, we're surveyed by and inspected by a whole bunch of people. DCH, when they came in 2 years ago, and then this year, we had two back-to-back deficiency-free surveys, putting us in the top 10% of skilled nursing facilities in the state. Top 10% are Milledgeville home. The Joint Commission, which I said also came this year, gave us the gold seal of approval, which is for operational and, of course, care excellence. That is something, again, we voluntarily participate in, and they awarded Milledgeville that gold seal of approval. The VA came and recertified us back in October. Minor deficiencies, no life and safety. I will tell you, you will not find a home out there that the VA inspects where they don't have deficiencies. There was a rumor, and I hate to say this, that our Augusta home, which is also a fantastic facility, absolutely had no deficiencies. Everybody has deficiencies, to include them. Our provider coverage. So something that you traditionally do not get in a skilled nursing facility is on-site physicians and on-site nurse practitioners. We have 2 full-time medical doctors, 2 full-time physicians on campus, on-site. We also have 4 nurse providers, one of which is a psychiatric nurse provider. That is something that in a traditional home, they may come in once or twice a week, right, and see patients as needed. So again, exceeding standards. When we go look at our survey data for family satisfaction, this last year we were at 94% for family satisfaction. 86%, I could only find a national average, is what skilled nursing facilities were throughout the country. And we've done a lot with capital modernization. Many of you may remember we opened a brand new kitchen and dining facility that opened in 2024, but of course we continue to monitor food quality, food temperature. We've purchased heated, cooled carts to make sure that the appropriate temperature and those meals are getting to our patients who now, post-COVID, are opting to eat in their room more so than they did before. They used to come to our dining facilities. And we've passed both this fall and then most recently less than a month ago, we got 100 on all of our health surveys. So I dare you to find a restaurant out there that gets 100 every time on their health surveys. Falls, that's a big issue in skilled nursing homes, and trying to reduce the number of falls, we actually reduced that by almost 14%. So that is true care to our patients and ensuring that they understand what may contribute to them falling, and also having the staff available to make sure we're there so that they don't fall. The resident cost burden, and I can talk all day about how the state of Georgia has really stepped up in these two homes with historic funding last year, but it's about $12,000 for a veteran that's not service connected. That's the cost of care for them over a month. About 4,000 of that, actually 5,000 of that is paid for by the state, about 1,000 is paid for by the veteran themselves, and then the other 6,000 is paid for by the VA. Those are for our non-service connected veterans. And then what we also provide that most skilled nursing facilities don't is transportation. So we take them to and from their VA medical appointments. We provide dental care, we provide mental and behavioral health care, physical therapy, occupational therapy, speech therapy on site versus them having to go outside of the facility to get their therapeutic needs met. So let's talk about capacity, because I know I've seen the emails that says, why in the world are you asking for a new veteran home when you have capacity in Milledgeville? Hopefully you'll understand. We have, you can see the facilities. So we have a total of 5 facilities that have patients. We have the Wood Building, which has our largest veteran count. It's 117 is what it's recognized to serve. We need to continue the renovations on that facility. That facility is partially renovated, and when we get it to full ADA compliance, we'll actually reduce the footprint to 99 patients per that building. Our Vincent Building, which needs significant renovation, and I'll give you the numbers. When we get that ADA compliant, it goes from 48 patients to 36 patients. That is a very small footprint. Our Russell Building, which I think many of y'all have seen as kind of the standard of care. It's that beautiful facility, also called the Subacute Therapy Unit, has been fully renovated at a cost of about $17 million. Beautiful building, it can hold 59. Our Memory Support Unit can hold 24. We're still waiting for recognition from the VA for our Transitional Support Unit. That's another 14. So overall, you can see that in Milledgeville, we have the capacity, once we do those renovations, of 232. The challenge is we are funded for 185, and I'll go into that in more detail. But let me show you what the current facility in Milledgeville looks like. And I know I've got some Milledgeville folks here. I'm looking at both Senator Williams and Representative Griffin. This is our Vincent Building, and this is a standard patient room. Separated by curtains, 2 people. It used to be 4 people per room is what we used to have. After COVID, we started putting 2 people per room, and so that reduced the census. This needs to be, we need to renovate it so it's up to the current level of care that's expected, not just by our veterans, but by the VA. And I'll show you a little bit what that looks like and why I think this is such a challenge. It's an old brick building. For those of you familiar with the Milledgeville campus, 1902 was the first building we've got. I mean, they gave us a portion of Central State. And so an old facility that is very hard to maintain and, of course, very hard to renovate just because of those cinder block rooms. It's hard to put a pass-through for a bathroom, make them single rooms, et cetera. And here's what your bathroom looks like. We have congregate baths at the end of the hall. So for those of you who are veterans and ever went to basic training and lived in a barracks, this is a barracks-style facility where you have multiple people per room and bathrooms at the end of the hall. I will tell you, for our aging population, this is very difficult for them. And that is one of the reasons why we receive complaints. It's mainly because, right, they are wanting single-person rooms and they are wanting their own bathroom. So the renovation piece on this, and this is the kind of the cost piece. So the Vincent Building, which I said goes from 48 to 36, once we do the ADA renovations and make them single bedrooms, is going to be almost $7 million. I don't know for 36 that I would recommend actually doing those renovations. That's a high price tag, and I do want to be a good steward of the state's money. Our Wood building, which is just over $3 million, and that's finishing off that project. Again, as you remember, that is our largest facility and will remain our largest facility with 99 beds once we're ADA compliant and go to single rooms. And just in case you think I'm only focused on Milledgeville, Augusta actually needs a full renovation. It is filled with asbestos. It completely needs abatement. And at about $35 million would be the state match for a new veteran home of the same size of Augusta. That's about what it would take to renovate Augusta. And Augusta actually wouldn't gain any beds if we built them a new home. So those are some of the challenges with the renovation needs specifically for our war veterans homes. So when you do a cost comparison, just over $45 million is needed for those veteran homes to be renovated. But you have to understand, and for those of you that are part of appropriations, the VA increases their rate every year. So their consumer price index that usually CMS, so Medicare, Medicaid, uses, we get that portion of the funding increased every October, sometimes more than once a year, by the VA. If the state doesn't match that, we have to reduce beds. So that is a compounding cost to the state year over year above what they currently fund us at. So you can see if we just renovate the legacy facilities, all of them, we gain a total of 63 beds above what we're currently funded, but we have that almost $3.8 million that compounds annually. And I'll give you a better chart on that in a second. If we just finish the Wood building in Milledgeville, we gain 47 beds at a one-time cost to renovate at about $3.5 million, but that will be another almost $3 million that will compound annually for the cost of care for those patients. If we build a new facility, it's $35 million in state funding because it's a 35% match. We do have the architectural specs on a 120-bed facility that's $100 million. The VA, we could leverage federal funding for that. They would put up $65 million, and that would be self-sustaining because we would shift models. We would shift models from our older facilities, which quite honestly require state funding because they're old. You cannot operate them at a profit. Nobody's going to come in and do a revenue sharing model with us. But in a new facility, they will. That is a model many other states use in their new veteran homes, which would allow us as a department, if we're in a revenue sharing model with a contractor, we are now getting a portion of those proceeds, whatever is contracted, and that can help us over time seed the addition of additional veteran homes, new veteran homes, again, to give that state match. It doesn't have to come from the state. Give that match to construct a new home or to do any capital improvements. That is how other states do it with their new veteran homes. So you can see kind of the numbers, 63, 47, or 120. And let me show you real quick, just your total renovation costs, again, operational costs for the 3% consumer price index, net gain, because I do not recommend the Vincent building, that's a high price tag for not a lot of return, only 47 beds. So let's talk about expanding. I just talked about the portion between what the federal government would pay and what the state would have to put up for us to be able to apply for a matching grant. Just so you know, that deadline is April 15th, but would allow us to leverage federal funding. And that funding from the state has to be in place no later than 1 August, but it'll give us a modern, ADA compliant, VA-aligned care environment, single rooms, single bathrooms, and I'm going to show you what this looks like. And again, it's a self-sustaining model that does not put growth in the state's budget. So it doesn't compound year over year like our older veterans' homes. It also allows us to expand geographically where there's a great need. So this is kind of the cost over time. You can see the $35 million, the one-time cost, at about 4.5 years of operation. If I was just to kind of put multiple people in a room, fund 120 new patients, in 10 years, I could fund 2 new veteran homes. I could fund that 35 match within about 4.5 years. So if you're talking about just the operating costs for those 63 beds, in just over 10 years, I more than would have made up for that $35 million. So money that would go out from the state above what we would need for that match, we'd actually be saving about $47 million with the first model. The second model in 10 years, we'd save just over $8 million. So we're being fiscally conservative over time and making sure we are actually looking at the long-term needs of our veterans. I know that y'all have seen this slide probably before. We currently only have 16 funded beds available in Milledgeville. That actually changed since we briefed House Appropriations. We've increased by another veteran and just had a job fair and are bringing on more staff. But why this is so significant is if we can hit 90% occupancy, and right now we can't because we have 185 beds. And again, part of the reason for that is because we need to renovate, and you have to renovate before you bring in new patients. If we hit 90%, then those patients that are in hospitals, so when we have to send somebody to the hospital for however long they stay there, 3-4 days, the state ends up having to fund that care. The VA does not reimburse it. If we're over 90% occupancy, the VA reimburses that cost of care. And you can see the need, right? I already told you over 50% of our veterans are over the age of 65, and that need is just going to grow year over year. So if there's a time to do it, the time is now, and I'll tell you why. So this is a grant process, again, goes through the VA. The other two states that have a higher gap in the number of beds needed are Florida and Texas. They just got new veteran homes, and we know they're not submitting this cycle for a new veteran home. So we would go to the top of the VA funding list. The only organizations that actually could beat us out are our Native American tribes if they were to open a veteran home, and those are much smaller. So if we were to able to put forward that grant with the matching funds, we would be funded for a new veteran home. In fact, I get calls frequently from the VA going, why hasn't Georgia built a new veteran home? And I shared this with House Appropriations. Georgia has never had a new veterans home. We have been given facilities from other organizations, have renovated them to make them work for our veterans, and you already saw what that looked like. So our residents, in fact, Senator Kirkpatrick is here. I'd like to point her out. So Chairman Kirkpatrick actually led a Senate subcommittee on do we need new veteran homes, and if so, where? That happened back in 2022. The findings from her committee said, yes, we need more veteran homes. Kind of the greatest needs are in South Georgia and in North Georgia. That's the report that we sent forward. And what we did this last week is we actually plotted where our residents come from. I don't know if you can see it, but it should be on your slide. In white are our residents in the Milledgeville home, and yellow are our residents in the Augusta home. You can see Augusta is kind of concentrated in the Augusta area. Milledgeville is a little bit more spread out, but look at where our biggest gaps are. And this is before we even plotted where the residents are coming from. South Georgia, specifically Southwest Georgia. If we did that little star, if we built a home in Albany, that would cover that region. And you're talking about 20,000 veterans just within a 50-mile radius of where we are proposing to put a brand new veteran homes. It's also home to an active duty installation. We've got about 1,000 Marines there at Marine Corps Logistics Base Albany, and we have a tremendous partnership with Albany and Dougherty County, as well as their technical college system who produces the nursing staff, right, the CNAs in a live-learn facility. We also have an agreement and nursing staff coming from Albany State, as well as a commitment from Phoebe Putney Hospital. So all of those things kind of coalesce to make this a great location, as well as showing the need is there. So what does this look like? This is the proposed site. It's just north, I know Chairman Green knows this very well, just north of Phoebe Putney. This is what the 120 beds would look like. This is an architectural rendering. This is what the rooms look like. So this is what contrasts to what we showed you before. Let me go back. What a single person room looks like. And this is the same architect that is doing these homes for states across the country, veteran homes. This is the standard of care you get in other states. And then when you look at the common areas, everything from the barbershop to therapy to caregivers to household dinings and the coffee shop. I'll go back one second. That is what the other states provide to their veterans, and that is what the one-time investment of $35 million for construction would provide Georgia's veterans. Again, giving us 120 beds versus at most probably 47 once we renovate our existing facilities. So I know I've talked very fast. Hopefully I've shared information that maybe you weren't aware of, especially about what we do in the department. I did want to specifically call out my group kind of in the back corner. Amazing group of people I work with. We are tirelessly working on behalf of our veterans, our military members, and their families. Most of us have military connection, if not are military ourselves. And this truly is a passion project. Serving, our people is what we just love doing, and it shows in the work ethic that these folks have. So with all of that, I know you'll have lots of questions because I've seen a lot of the dialogue going back and forth. I will tell you that in many cases it's grossly inaccurate, so now's your time to ask me questions. Anybody?
There's no question. No, I'm just kidding.
Chairman Bonner. Thank you. I'm gone.
Thank you, Commissioner. Let me just say, your ability to stand up there and present for going on an hour is amazing. So first, Chairman Tarvin, got a question from you right up front.
Thank you, Commissioner Ross, for a quite in-depth presentation. You did a good job. It was very quick for that much information, but the things that interest, we have heard a lot about the veterans nursing homes and things, but what's I'm going to say caught my eye, but maybe my heart, was on pages 6 and 8. And offline, I'm going to go through Chairman Bonner and got some questions as far as when you see these darker red areas, the percentage of Georgians that are general population and the 80% that are not veterans, how many live there, how many veterans live there, or are veterans retained in the Southwest because of the military bases, and then you go up to middle Georgia. The west side of Georgia doesn't seem like there's as many suicides, and I guess Gillum's over there and Benning, and I don't know. That's the kind of things I want to know is statistically, and I guess if they're 56 and younger, it's all got to almost be Middle Eastern type war, and in that type war and the trauma they go through, the deployment rate and those type things, I'm very interested in it, and the Cobb and county and Muskogee, I guess it was, in the last the months before 22 summer. Make sure we're not seeing more minorities statewide committing suicide than whites, and try to figure out if there's a reason and what we can do. And I know you're doing that,
yes,
but
sir.
I've got a lot of questions, but mostly general population as far as where they are. Are there more percentage veterans there than there are general population out of the 12 and 13 versus 87? But thank you anyway, and I'm going to get Chairman Bonner to give you a big list to answer for us.
Okay. Well, and I'd be happy to address some of that. So if I could have pulled up our referral system and the Insights dashboard. So part of what we have as a state, and this has become a tremendous tool for us, is I can drill down and find those hot spots. So I know overall, looking nationally, what they call the social sufficiency score for the country is 26. The higher your social sufficiency score, the greater needs you have. For the state of Georgia, we're sitting at 34. If I drill down by county where I know I have veterans, because we input this data into the system, so all the veteran data we get every month from the Department of Defense that says these are the folks that are coming to Georgia, we get that in the system. They pull some commercial data to say, hey, that's a veteran in the household. They pull things like credit reports and insurance and literacy, things like that for these households. We see the largest concentrations, as you would expect, are in Metro Atlanta and outside our military installations. I will tell you one of the reasons why we partnered with a significant community partner for us to do a We Care Fair, and if you've not had one and you need one, let me know. I know they're building out the calendar, but we did that in Columbus, was because we saw the Columbus area as a hot spot. And so some key factors that we've addressed through some proactive outreach, and again, if I could have gotten those slides up, I would have put them up. But let me talk you through them. It's much more impactful if you see it. But loneliness which is the key indicator for veteran suicide, right? That lack of social connection is high across the state, and it's specifically high in those areas where we have our military installations. In this case, it was outside of Fort Benning and Fort Stewart were kind of our two key areas. And so we did a big We Care fair there to bring a whole host, hundreds of community partners to do a one-day event to help meet veterans' needs. And so that's how we're kind of targeting our outreach, is based on those demographics, as well as based on what we identified as needs. So loneliness is number one. Guess what's number two? Housing instability or homelessness. Not a surprise, right? And then financial insecurity is a top one. And so that's what we see, especially if we drop down to specific counties where we have those higher concentration, and then even in smaller counties where we know we have veterans, but they're a little bit more dispersed. We are still, hold on, we will do this while I log in. That'll make me log in again. Okay, so let me show you what this tool provides us that we never had before. Again, this closed-loop referral system allowed us to take our veteran service officers and our appeals officers that were only doing those benefits claims to now connect to that holistic kind of community of support agencies that they never had access before. They might have had, I'm going to age myself, a Rolodex or a sheet that had a list of all my key community partners that, again, was probably outdated and may not have been updated recently. Those folks could have lost grant funding, they could have gone out of business, whatever the case. This is all live data that gets checked very frequently. If I'm going to go, I think I'm going to go to Population Explorer. So this is the Insights data. You can see, and this is our data. So the top predicted needs, and this is for 285,000 veterans that we've identified through the system: financial insecurity, loneliness, utility needs. You can see at 36% financial insecurity for Georgia veterans compared to 20% nationally. Again, double the rate for loneliness. Again, a key contributor to suicide. Utility needs, all of the financial information. I'm going to real quick just jump. This is kind of showing some other states. The numbers are just
Commissioner
ours.
Ross, if we could, we've got
Lots of questions.
Yeah, we got lots of questions we want to go through. I think that the takeaway for Chairman Tarbin is that we do have the ability to identify some of these metrics. What we need to do is work on changing those. Right. That's right. Thank you for that. All right. Next, Senator Wicks, you had a question.
Good presentation. Thank you for.
Use your pull up that microphone if you would, Senator. There you go.
Good afternoon, everyone. Thank you for good presentation, and thank you for the overview. So my question is the flow of information. One, the new changes that are coming down for the disability rating. How are we going to get that flow of information from your perspective to us down to our constituents? Because I've been receiving a lot of phone calls, a lot of misinformation, or so what is the way ahead for information like that, so that way we can make sure that our constituents are getting the right information? That's one. And then number two, money in the budget. I know there was some money that was put in the budget or transferred to your department. So I'm just trying to figure out what is the way ahead with the money that was put in the budget for veteran homelessness.
Okay.
So those are two of the things that would be great that you talk upon to give us some more clarity and some more feedback on what's the way ahead
Yes,
with
ma'am.
your office.
Okay, thank you, Senator Wicks. Great questions. Let me answer the first one. So for those of you who have not gotten the news yet, the VA is considering changing the disability ratings, where if you are considered control on medication or may have had surgery to correct a disability you were previously rated for, that the VA is now looking at going back and re-rating everybody and using a system with AI. It's put out as a final rule. I will tell you it is still in the comment process. That actually runs for a little while. It didn't necessarily go through the normal flow, but this would impact veterans significantly. As you can imagine, if you have to choose, say I'm a disabled veteran and I'm taking medication that allows me to manage my hypertension. Let's use a great example. And I'm rated X amount for that. And that's providing me income, granted fixed income, right? It's a fixed income that the VA is providing for that disability because my service in Vietnam has resulted in high blood pressure. I now, if that rating is reduced because the medication I'm on kind of puts my high blood pressure in the normal range, what do I think, and this is Trish speaking, not Commissioner Ross speaking, I think a lot of veterans are going to consider, what do I do to recoup those funds? Because that's what they live off of. And so am I going to compromise my health and not be on medication and go back and get rated for that disability? Or am I going to take the medication and now get a lower rating? There's lots of discussion and discourse around this. I understand kind of the genesis of it. I will tell you there are bad actors in the disability space, right? We all know that if you've ever done this. There are folks that may not be completely truthful in what occurred during their military service. But I know from a national organization, so I'm a member of the National Association of State Directors, again, all 50 states, 5 territories, District of Columbia. I happen to be the vice president over the Southeast region, which includes Puerto Rico and Virgin Islands. We're all getting ready for testimony. We'll do that at the beginning of March before that comment period is over. So I know a lot of folks are concerned, and I will tell you how we're going to get out the message. So our Director of External Affairs and Communications is back there. Social media is going to be our friend in getting the word out, but that's not the only way. If you read Georgia Code, we're actually required to educate our veterans on any new programs, on any big changes like that. We do have a communication system that can get that information to every veteran we have in our file. So just over 300,000 veterans that have, opted in to get our communications, we could communicate that directly to. We could also get it out to y'all to share with your constituents. So if that rule is passed, and once that if that does become law, we will make sure to get that out. Right now, again, it is still in the comment phase, so I don't want to, one way or another, who knows what'll happen. The money that was transferred from DCA to our budget for veteran homelessness, as I understand it, that was a concerted effort, knowing that veterans make up about 20% of our homeless population, to make sure that that funding was provided to serve that community. Again, there are still quite a few. Oh, it looks like breaking news, everyone. VA backtracks on new disability rule 2 days after announcing it. So that just happened while we were in here. Okay. Let me talk about veteran homelessness. Again, a big issue for our population. So if we're provided that funding, and of course it still has to go through the budget process. That was not in the governor's recommended budget or the House recommended budget. That came out from the Senate. If we were to get the funds, we will have a plan to use them. If they were to revert back to wherever the conference committee puts them, we would support, of course, the legislature's decision. We do want to make sure that our veterans are taken care of, but I not knowing how that is all going to play out, because of course we still have a little bit of the budget process to go on the amended budget. If that stays in my budget, I will be happy to talk about how we'd work that.
Great, thank you. All right, I'm going to go Dean Green, then Representative Scott, Representative Griffin, and then over to Representative Davis. So,
thank you so much. Thank you for the work that you're doing. My concern, and thank y'all for having this joint hearing, is down in Albany. And that is, we're trying to figure out a way to get the $32 million. And is it possible that we could do this over a 5-year period that still could draw down the federal dollars?
So the challenge is with the VA matching grant, because it is a matching grant, we have to have that 35% in our budget on 1 August. So unfortunately, that's not the way the federal grant process works. Now, this could be bond funds, so it doesn't have to be cash. That is certainly up to the Appropriations Committee and the folks that are part of that process. But yeah, thank you for that question.
Well, I think we're going to need some help from these two committees to try to make that work down there. Albany has really reached out to do this project, and as you said earlier about the hospitals and the Albany State University and the county giving the land for the project there. So stay tuned. We're gonna try to do something. Thank y'all so much for doing this joint.
Yes, sir. Thank you.
Thank you, Representative Scott.
Thank you for coming this afternoon. Now, I know it's a lot of organizations out here, but again, I would like to know about the funding. How are people being funded, these organizations, nonprofits, organizations, and even your office, with getting information? Again, I heard what you said about getting information out to veterans, but helping veterans. There's so many organizations we have out here to help veterans, but yet instead when veterans go to reach out to get help, they never have any money. Never have any money to help veterans, one way or another. And I would just like to know, what are we doing to try to control some of this? Because organizations could receive money today and have none tomorrow. And I'd just be trying to figure out, if you all out here to help veterans, then where's the help really for veterans when they are seeking help? Because it seems like it just something just not right with all the money that the Veterans Department and all these people receiving. It seems like it's no money out here really to truly help the veterans when they're coming out trying to seek help for one thing or another.
Okay, Representative Scott, thank you for that question, and thank you for allowing me to kind of unpack that a little bit. I should say, as an organization, as your State Department of Veterans Service, we don't get funding to help veterans. We get funding to operate our department, and our people help veterans. So we don't have a fund source where if somebody is needing assistance in housing or some other financial assistance, we don't have funds for that. We've never had funds for that in our almost 100-year history. What we do have is, through the closed loop referral system, our community partners. But I share your same concerns. So we saw a big sea of goodwill kind of at the end of, the height of the global war on terror, and a lot of veteran organizations were getting a lot of funds. We've seen a lot of that shift to different populations, because most folks assume that military, which is incorrect, we're no longer at war once we pulled out of Afghanistan. And that's absolutely not the case. We have folks deployed in every theater throughout the world. And you're right. So a lot of those organizations, those nonprofits that used to receive philanthropic dollars, used to receive grant dollars, we use them too. That's where we send our veterans to get assistance. Many of them just simply don't have funds anymore. I know a big one we used to use all the time, and they no longer have funding to be able to provide emergency housing assistance is what they used to do. And so that actually has been a shift nationally.
I'm sorry, follow up. How can we get a list of these organizations that are out here to help and assist veterans, so that when we're getting the calls, we will know where to send people for help? How can we get a list of the organizations? And truly, I would like to know the amount of funding that they are receiving also. And I understand what you're saying, but is it anyone that does any type of oversight over these organizations that have the money for these organizations?
So I would say this is just from my perspective. So everybody that's given a federal grant, there are very strict regulatory and reporting requirements. You can get those off of usually the federal government, whether it's the Supportive Services for Veterans and Family, the Homeless Veteran Reintegration Program grant, Department of Labor, VA grants helping some of this. You can see which agencies are receiving that grant, how much money they get, and then you can go look at, they're supposed to be posting their financials. For nonprofits, 501c3s, they're required to post their 990s. And so there are various charity websites where you could check out the veracity of their information as well as what they're doing with their funds. But that 990, that IRS form, actually shows you exactly where they're spending the money. So those are two ways. But I would say if you're trying to figure out where to send a veteran, send them to us. That is why we're here. Again, offices 55 across the state. We cover every county. We can do it virtually. If they just need resources, they can do it online by scanning the QR code, putting in their own information as far as their needs, or again, we can case manage them. Additionally, this is sitting on our website. So if you point them to our website, this information is in there. And I know last year we gave you that great state benefits books for veterans. We're actually expanding that to include our military installations. That's still in the works, but we're hoping to get that back out to you. And it also had this information in there. So send them to us, send them to our website. We will make sure we try to get them whatever assistance they need. But I will tell you, specifically on the housing side, money has just, it's dried up, quite honestly, because the housing market, and it's just so expensive.
All right, thank you, Commissioner. Representative Davis.
Thank you. Am I on? Okay. Thank you, Chairman. My question was already asked by Representative Scott. I just need to follow up to ask the state benefit booklet, where can I get another one or an up-to-date one?
We will get you a new one. We still have last year's. We're currently putting together all the information for this current year's. And so I'm looking in the back to see how close we are to getting that one done. But we're hoping to get that. We'll get that to all of y'all, again, once it's published. Again, we're adding some additional information to that book. But we can get you the existing ones. I'm not sure how many we have left. 3 cases. So we've got a few, not many. And then, of course, we're getting ready to produce the new one. But we'll make sure y'all all get the books, the new ones, once they're produced, and we can get you some of the old ones.
And as a quick follow-up, is it
Yes, ma'am.
best for us when we are receiving emails from veterans? We have some veterans that need the help individually, but then we have veterans that serve the grassroots community that are looking for resources. Do we just forward that to you so that you can see exactly what they're asking for, or what's the best way to communicate?
Yeah, absolutely. So we have, great question, and I probably should put this on a slide. We have a general inbox. It's GA for Georgia, VET, V-E-T, service, SVC, at ga.gov. So GA VET SVC, GA VET service. That is our inbox. That's where most of y'all send, or your staff send, constituent requests. And that gets funneled. There's a whole bunch of us it goes to, so somebody can jump on it right away and can connect with that veteran or can connect with that group and then get them to either the right resource, get it over to our federal partners if that's appropriate. So that's the best email, because that gets to about, goodness, I think it's grown to about 10 of us now. So somebody will always answer those emails.
Great, thank you. Representative Townsend.
Thanks, Mr. Chair. Thank you, Commissioner. Appreciate you being here. Just a question to kind of follow up. This could be online or offline, whichever way you want. If you have the answer, if you could give it, that'd be great. But we talked a few weeks ago regarding the bed situation, the subacute therapy, and how there's a quagmire right now of we have empty beds, but you don't have the funding or the staff, you'd have to have a new contract to fill those beds, which required new staff. So you need to have appropriations from us to be able to go seek another contract to fill those beds. And you guys want to get back to me about what that amount would be. Has that kind of come out yet or developed?
It hasn't, and thank you, Representative Townsend. I appreciate the question. If I could kind of clarify. So we do have 16 additional funded beds in Milledgeville that we're working to fill. And as you can imagine, almost as soon as we fill them, we do have individuals pass away. It's the nature of the skilled nursing business. We have netted, we're at 169 at the moment out of 185. So we're very close. We're, again, 16 beds for funding that we can bring on. Again, our current contractor, we're in the process of a request for proposal for whomever is going to be the contractor starting 1 July. Our current contractor just held a job fair last week and are onboarding staff because we've already told them priority is to open up the rest of the beds in that subacute therapy unit. And so they're working that diligently, but we're also in the middle of a procurement process too. So there's no new additional money that we're requiring to open the rest of the beds. How we would do that is, just so you, and this is probably too much information, Chairman Bonner, please forgive me. For those that are 70% or higher service-connected disabled, the VA covers their entire cost of care. And that is honestly what the subacute therapy unit was designed for. So it is going out, they now have a marketing person, it is going out, me working with the Augusta VA, the Atlanta VA, the Dublin VA, to be able to get those folks with skilled nursing needs to our facility in Milledgeville who also have the mental and behavioral health needs too. And so I'm not necessarily asking for additional funds because again, to bring more than that 185, I actually need to finish renovating the wood building.
If I could follow up.
Yes, sir.
So how many, I guess, currently beds not being used? And then second, all the beds that are being used, are they used for what it was intended for with the subacute therapy unit?
So all beds in the subacute therapy unit are being used for that population that does have mental and behavioral health challenges.
Yes.
And so that is, let me go to my slide with my numbers, because should have gone back instead of going forward.
And as you do that,
Let me give you.
So you're saying July 1, will you think the unit be full with
Yes, I mean, as right now we're bringing in them as fast as we can get them through the admissions process. So we're tracking to be close to getting that facility filled. And so this is kind of total number of beds, 232. Again, 185 are funded. We're really only the 16 beds short right now, which is basically a floor of the subacute therapy unit.
so no new requests then for funding to make that happen?
Right now, no, because the request for funding would be to renovate the wood building. Subacute's already renovated, and we have the funds to be able to bring on additional staff and to fund that contract. And so the renovation funds, just so you know, were projected for the FY28 budget. We did that actually last year.
So to clarify the question, so mainly I understand.
Yeah.
What you're saying is that we currently have 16 beds with nobody in them, correct?
That are funded, yes, sir.
But all of those beds are funded. We just don't have people in those beds.
Correct, nor have we onboarded the staff, because we have to onboard the staff to be able to serve that floor, which is, you have to have nurse, CNAs every shift. And so they're working on that. So it's an iterative process.
But essentially, it's not an issue of funding to fill those beds. It's an issue of staffing to fill those beds.
So now staffing. And I'm assuming they had a job fair and all that. We can get offline for that back in the fall to try to do that. So
yeah.
I guess I just want to make sure it's, we're trying to, with full zest, to staff it fully so we could cover it fully.
And we are. And so the way it typically works, so to maximize the funding, so you really need pretty much all of the rooms filled on a floor before you onboard staff, because that's the only way the contractor makes money, and it's value added. So in the subacute therapy unit, the majority, 2 of the floors are 20 people, so we need most of those 20 people ready to come into the facility before we onboard, again, that 24/7 nursing staff. And so that's where we are right now.
Okay, thank you.
I hope that clarifies it.
Well, so just a couple of questions that I've got then. What is the impact of the VA not recognizing the facility yet? What is that cost? Is that money we're not getting, or is that some sort of certification? What is that? What's the impact of that?
Chairman Bonner, thank you for that. It's both. So it is the ability to get funded for any patients we put in those 14 beds that are the transitional support unit. Until the VA certifies, we had to get that certified because it's a brand new facility. We didn't have to do that on the Russell building because that was a renovation. So it's a much more in-depth inspection and certification from the VA for a new facility. So every patient that's in the TSU, and we do have patients in the TSU, they're state funded, as well as a portion is paid for by the resident. We don't receive VA funding until the VA certifies us.
And when do we anticipate that being?
I think, Russell, when are they scheduled? March is kind of the date they've given us. Again, I know that's changed a couple times due to government shutdowns.
But at that point, then they'll receive the 100% funding because of the category they fall in, correct? Or at least ideally.
It depends. They could receive the VA matching funding based on the service connection, that disability rating for the veteran patient.
Right. All right. Understand that. All right. And then, and I'm sorry if you said this, but how many homes did the study? I know the study said that we need at least 3 more homes, but what for a veteran population our size, how many homes should we have total?
So our Delta right now is 1,500 beds, and the ideal size, and I've benchmarked this against a lot of other states, I've done a lot of research, is 120 beds. So you're talking about over 10 new facilities is what we need. Now the study said North, South Georgia, Metro.
Right.
But 10.
And then on the Wood building, when is that money programmed in for that renovation?
We have requested it again. This was done. We put it in the COB system, so the capital outlay bond system last year for FY28. The biggest return on investment right now is a new home because that nets me 120 beds, and I get federal funds to match that. In the Wood building, I get no federal money because we're reducing beds.
Right.
VA funds additional beds.
But as it stands now, we don't have the money we have not appropriated the money for either, correct?
Correct.
Okay. Okay. All right. Did you have another question, Representative Davis?
I just wanted you to know that we Googled and then found the digital.
Oh, awesome. Okay. Yeah, and I forgot to say, we do have a flip book on our website, so it is digital.
All right. I don't see any more questions on the board. Just a couple of closing comments. So, Representative Scott, a couple of to your question, which I think was a great question regarding how do we ensure veterans and veterans organizations, how does that we network everybody in? I will say that the Unite Us platform is certainly is a good way, and all of those organizations that are a part of the Unite Us platform have all been vetted.
Correct.
Right? And so all of those are essentially what we would consider trusted organizations. The Warrior Alliance also has a similar platform. Of course, it's a non-government entity, but they also vet those organizations that they allow on their platform. So those are 2 of my good go-to that I point folks to in terms of that. But to the larger point, we do have to figure out a way as a state, I think, to connect a lot of these dots for our veterans and those organizations. Very much like this healthcare debate, we've got to figure out a way to get those that need care to the people that want to provide care and get rid of everything in between, right? And so we'll certainly look forward to working together on how best to do that. We're dealing with a population, as we all know, as veterans, that typically don't like to ask for help. And so a lot of times it's not the easiest thing to round them up. Senator Anderson, do you have a question?
I would like to make a comment. Mr.
Absolutely.
Chair, thank you so much. Thank you, Commissioner, for the presentation. You made a comment that you were trying to be fiscally responsible with the funds that have been provided for veterans. But I admonish you to do your best to provide what is best, or do your best to provide what's good for them, as they have served this country and we remain safe. Because when people retire, they become veterans. So I just admonish you to pay very close attention to how you can best maximize on that to provide the best for them.
Yes, ma'am. And absolutely, I will share that we are doing that. So we are a fairly small state agency, but the fact that we've expanded the number of offices to cover more geographic areas, we're trying to tackle that transitioning military population, connecting to veterans, providing this closed-loop referral system to be able to do more than just the benefits piece. Our growth in what we do has been exponential over the last few years, and we've not grown people. So, yeah, thank you for that. I fully agree. I mean, we're both Air Force veterans. I know my Army, but but I mean, veterans are my people, right? And that is what every day I get up passionate about, serving that population, their caregivers, their survivors, their families, be it military, those that will soon be veterans, or those that have already taken off the uniform. So thank you for that.
Yeah, and for those of you who do not know, which I can't imagine you don't, Commissioner Ross is not just our Commissioner of Department of Veteran Services, but she is a veteran, retired 06 in the Air Force that had an impeccable career. And so like me, we have an interest in these nursing homes because we're probably going to end up in one, right? So we definitely have. All right, Chairman Payne has a question.
Well, before we close out, I just want to ask you the magic wand question. If you had a magic wand and you could change one thing, what would it be?
I only get one? We're working, so for those of you military, we're working so many lines of effort, right? Right now, making sure our older generation of veterans are taken care of with new skilled nursing homes, and renovating and being good stewards of what we already have would probably be magic wand number one. We're making a big dent in mental and behavioral health, but it's really hard to measure prevention. But everything we're doing on the other side of things, we know we're making an impact. And I've got story after story, but if I could get every veteran mental and behavioral health care that needs it right when they need it, and they no longer are thinking about kind of checking out of this life, that would be, of course, both of those magic wands. I do it in a heartbeat, as well as veteran and homeless should never be in the same sentence unless it's that veteran's choice.
Thank you. Thank you.
Well, thank you so much, Commissioner, for being here. Thank you for all those. I will just say that when it comes to our home in Milledgeville, we're certainly leaning very heavily on the members of the delegation there. Representative Griffin is certainly helping us out, and I see Senator Rick Williams back there, who has been a tremendous help in Milledgeville, and we certainly continue to look to you for some assistance, Senator, and thank you for all you do for that community. And with that, I see no other questions, nothing else for the good of the order, and this hearing is adjourned.